Session organized by the National Robotics Program in partnership with A-Star, EDB, and ESG. So we are actually honored to have 6 speakers from the industry who will be sharing their perspectives on how they have come up with robotic solutions to make a difference in our fight against the COVID-19 pandemic. So these 6 speakers are actually Prof. Chenny Ming from Transformer, Mr. Dylan from Lions Board International, Mr. Ang Chor-Chen from SESTO Robotics. Can I welcome Mr. Ang Chor-Chen from SESTO Robotics next to give his slide?
Okay, good morning, Prof. Quek and speakers, esteemed speakers and guests. Yeah, so I'm from SESTO Robotics. So the next slide, please. Yeah, just a quick introduction for those of you less familiar with our company. So SESTO is an AMR manufacturer and solutions provider based in Singapore. We were spun out from Hope Technique in 2018, and we serve customers primarily in the semicon, manufacturing, and healthcare sectors. We have a track record of delivering multiple payload applications, and the photos below, you see some of them, to various customers. One to highlight is the SESTO Prime, which is the image on the left. So that's our AMR platform, which we integrate with a 7-axis robot arm to do picking and placing of silicon wafer pods in the semicon factory. So we have a track record of doing various applications in different industries. Next slide, please. Okay, so today I think the topic at hand is what is the industry perspective on robotic solutions to combat COVID-19 pandemic. And I think at the left column, I think these are familiar requirements that has kicked in since the circuit breaker measures have been implemented. Things like social distancing, regular temperature taking, stepped up hygiene, ordering meals and telepresence. So I think all these are the new norms in workplaces and also in our personal home. And if you look at and you survey what is in the market currently, or has been in the market in the last few years in terms of robotic solutions, I think these are some names which we may be familiar with, especially for social distancing. I think Singapore made the news recently by using Boston Dynamics Spot robot to serve as a social distancing marshal. And for temperature taking, I think there are various solutions, some from our other vendors that are presenting today. One example which I saw recently is a collaboration between Omron and SK Telecom, where they essentially use a LD series Omron platform, and they integrated a thermal scanner onto the robot. It also dispenses hand sanitizers as well. So it's kind of like a multi-purpose, disinfection thermal scanning robot. In terms of stepped-up hygiene, I think UVD was one of the pioneers in the space. There are quite a few companies in the space now, including some of the speakers today. And of course, cleaning robots like the Lion Bot and Avid Bots, which we're seeing at the airports. I have actually met Blue Ocean Robotics a few years back when they first spun out UVD Robotics. And as mentioned by some of the other speakers, I think this was really a niche kind of market product. In terms of use case and application, it was very much targeted at healthcare settings. But in light of COVID-19, I think some of these solutions are becoming more and more mainstream. In terms of getting our meals takeaway as well as ordering in, delivery of our e-commerce purchases, in other countries, we've seen in China and the US, solutions like Neuro and Starship making deliveries on the streets. So again, while this is primarily still perhaps limited to campuses and more suburban towns, perhaps with COVID-19, some of these companies will be able to overcome some of the barriers to implementation, and this will become, again, a wider adoption in more places. And of course, for telepresence, again, supplementing perhaps Zoom meetings like what we're doing now. In some use cases, like in the medical industry, there could be a use case or increased use case for using robotic solutions like the ones from Double Robotics. So the reason why I highlight some of these robotic solutions is because they're already in the market. And I think we have to be mindful as we are local players, how are they addressing some of these requirements, which has been more in light in view of COVID-19, and how else can we do better in terms of our solutions. Okay, so next slide. So just to share in terms of our journey for Sesto, when we look at what kind of applications, robotic applications and solutions that we can develop and deliver to the market in response to COVID-19, some of the key questions we ask ourselves is what applications or what new requirements benefit from a robotic solution? So it's a simple but important question to ask because if the robotic solution delivers value, which is similar to what other non-robotic solutions are already delivering and just as effective, then perhaps the value proposition and the adoption may not be as high, right? So sometimes there could be cases whereby robotic solutions are developed and they become like trophy projects where some companies have some adoption, but it's not widespread in the market. So we have to take a hard look at asking ourselves as a company, if there are other solutions which are available, for example, temperature taking, if that can be done effectively at a gantry point in the building by thermal scanners which are stationary, then is there really a need for a mobile platform solution to be integrated? And the third question from our perspective again is what is the real value proposition that we want to deliver as a robotic solution? And I think from this discussion today, various companies and vendors have a different take on what's the value proposition, which is very interesting, and we learn from each other. And the idea is to really understand the end customers and the market requirements and to come up with the right solutions and features so that they really address the key pain points from the customers. So for now, in our case as well, we looked at one of the industry kind of evolving factors. So I listed down 3 of them. As we all know, there will definitely be increased footfall in public facilities as Singapore and other countries enter into more relaxed COVID-19 measures, such as phase 1 and phase 2 in Singapore. So definitely at the train stations, in shopping malls and other public facilities, there will be more and more people flowing through them, right? So as you can see from the list on the right, this list was taken about 2 or 3 days ago. It's an increasing list as every day we see reports of new places with confirmed COVID-19 cases having been to these locations. So definitely this list will keep increasing, and I'm sure the facility operators of these public facilities or shopping malls will be thinking of how they can better step up their cleaning and hygiene regimen. Okay, and of course, the reality on the ground too is that for many of these facility operators, they do have a cleaning crew, be it outsourced or in-house, and the cleaning crew, of course, are facing greater demands for cleaning and disinfection because of the increasing frequency of people coming into their facilities. Okay, next slide. Yeah, so for us, we decided to focus on disinfection as a use case and to develop a solution that combines our Sesto mobile platform. We looked at a few key requirements which we hear from the market. One of it is the stepped up frequency, as I mentioned. And in light of this, just to spell out a bit more, in terms of stepped up frequency, it has got to be a solution that is working both day and night time. So we find that by using certain disinfection or sanitizing solution, that may only be available for use at a certain period of time, for example, after operational hours, because, for example, these applications are not safe to be operated whilst there's people around. So we needed a solution which combines both day and nighttime usage, because it's during the day when you have more people actually going through these public facilities. The second one is, it's a typo there, the solution has got to be both safe as well as effective against viruses and bacteria. So safe in the sense of being able to be used in the presence of people, especially in areas like hotels. When hotels open up, when airports open up, and of course, shopping malls and SMRT stations, right? And it has got also to be effective against the viruses, and especially the SARS-CoV-2, which is top of mind for most people when they talk about disinfection these days. And then the last but not least is, which I think the earlier speaker mentioned, Dylan mentioned, is it's got to be easy to use. So again, disinfection mobility solutions has got to be something which an end user or an operator is able to control and manage on his own or her own with minimal training. And of course, very importantly, you need to generate a report so that you're able to basically identify which are the areas where the job has been done and which are the areas perhaps where you need to have a supplemental cleaning process. Okay, next slide. Okay, so for us, Sesto, we came out with this product, which we call Sesto Health Guard. It is a mobile autonomous disinfection vehicle. The way we look at it, at providing a solution for disinfection is twofold. One is using UVGI, so UVC lamps, and then the other way is by having a multi-directional sprayer. So essentially it sprays a disinfection solution, which I'll talk more about in the following slides. So it's got to be safe, as I mentioned, with people around, as well as an automated process so that you alleviate the manpower requirements, which is currently required to do these processes. Okay, next slide. So for UVC, for those of you less familiar with the application, it is been deployed in many other industries, such as food manufacturing, healthcare as well. And they're using a UVC wavelength at 254 nanometers. It has been proven in various applications and cases to disinfect, to destroy or inactivate the RNA of bacteria and viruses. So for us, we are again also looking at the use case of how we can clean the facilities and we identify high-touch surface areas as the place or the zones to focus on. So we're not trying to disinfect the entire room or facility because that will be too much time involved in that process, but to target certain areas where the robot comes into play. We're also looking to achieving 3-log deactivation or inactivation of bacteria and viruses. And again, based on a certain workflow, which we work together with the operator, we're able to cover a certain space and area within a certain period of time. Okay, next slide. So over here, we actually partner with a disinfection solution provider. So we're not in the business of selling disinfection liquids or solution. Of course, traditionally, there are many different sorts of disinfection liquids and solutions used in the market by cleaning companies. A lot of them are, which are listed in the NEA website, they do have some sort of chemical or chlorine involved or hydrogen peroxide. So usually these traditional disinfection liquids or solution will not be so safe to be utilized when there are people around. They usually have an odor as well as they'll probably irritate the skin and the eye. So we looked around for the best available solution in the market that's commercialized in terms of a product that's able to be sprayed onto surfaces and if need be even sprayed into the open space while not irritating and not providing any what you call irritation to the public. So the product we picked, which is SAO, is MSDS rated 0.0.0.0, which is almost the same as tap water. So it's non-alkaline, non-allergenic, and it's actually safe for people around, which is the key value proposition that we're trying to deliver. And once it's actually sprayed on the surface, it does the disinfection within a minute and is able to inactivate a surrogate for SARS-CoV-2, which is what's listed below, the MHV-3. Okay, the next slide. Yep, so again, the target, I guess, market we're looking at are some of these which are listed here. These are, again, public facilities or facilities which eventually will have people coming back to their premises, and the facility operators will definitely need to have a plan how to deal with that. And with the increasing list of premises which have SARS-CoV viruses, brought in by confirmed cases, again, there will be a greater demand for this sort of product. Okay. So, so the last slide essentially is, again, we're mindful of the market requirements, and productivity and usage is also a very key value proposition. And so for us, traditionally, because our robots have been targeted and used in manufacturing environment, as well as healthcare facilities, we do have a high uptime of 6 hours for usage. So essentially the robot is able to operate with either the UVC light or the sprayer, alternatively, for 6 hours before a recharge is required. Okay, so that's the end of my presentation. So again, be happy to take any questions or clarifications later on.
Okay, thanks Chor-Chen for sharing. Let's welcome